Care Authority's COFA Islander Facebook Live event in an overview of the COFA Islander programs and Apple Health Medicaid. As you may know, the weather in Washington State is a bit stormy. If we lose connection, we ask for your patience. My name is Roz Leon Guerrero, and I am the COFA Islander Programs Manager with the Healthcare Authority. Joining me facilitate this event is Ariel Piertek. Ari, do you want to introduce yourself?
Yeah, thanks, Roz. My name is Ariel Pertek. I work at the Healthcare Authority in the Office of Medicaid Eligibility Policy. And today we will be going over some Apple Health and COFA Islander programs information.
Thanks,
Paige?
Ari.
Hi, everybody. My name is Paige Lewis, and I also am with Healthcare Authority and with the Office of Medicaid Policy, Medicaid Policy and Eligibility. I'm going to be talking today a little bit about classic Medicaid, and I'll take it to you, Steve.
Greetings, everyone. I'm Stephen Kozak, also with Medicaid Eligibility Policy here at Healthcare Authority, and I'm going to hopefully be able to provide a good response to any questions any of you have today.
Thank you both for joining us. We are very excited to have you all, as well as two community members. These two individuals are part of the COFA Islander Outreach Work Group and assist COFA communities enroll in healthcare. This partnership has really helped in the anticipated smooth transition to Medicaid for our COFA communities. We have Carlinda Jabjalan and Renza Milo. Could you please introduce yourselves? We'll start with Carlinda.
Olive. Yadain Carlinda Jabjalan ngajarwalipin better altogether. Thank you for inviting me. I'm Carlinda again with Better Altogether, a COFA navigator. Jojum Romajaga presentation.
Thank you, Carlinda. Renza?
Hi, everyone. My name is Renza Milo. I'm with the Pacific Islander Health Board. I'm a COFA navigator working with the Chukis community. Thank you.
Thank you both so much for your advocacy and dedication to our COFA communities in Washington State. This afternoon, we will cover Apple Health Medicaid restoration. We'll give an overview of the COFA Islander programs. We'll talk about Apple Health Medicaid. We'll talk about classic Apple Health next steps. We have open enrollment. We'll go over some scenarios, and we will share some outreach efforts that we've done, as well as share resources, and we'll open it up with Q&As, with a question and answer. Please send us your questions, and we will respond to them at the end of the presentation. So an overview, the Consolidated Appropriations Act 2021 restored Medicaid benefits for individuals from the Republic of Palau, the Federated States of Micronesia, and the Republic of the Marshall Islands. COFA Islanders were limited in their ability to receive Apple Health prior Medicaid restoration, although children and pregnant individuals were and continue to be eligible for Apple Health. We have updated our eligibility system to allow COFA Islanders to receive Medicaid as qualified non-US citizens exempt from the 5-year bar. Most COFA Islander healthcare enrollees under age 65 without Medicare have transitioned to Apple Health for adults on July 1st. Individuals in the COFA Islander healthcare who are age 65 and older, or those with Medicare, must apply for Apple Health through Washington Connection with the Department of Social and Health Services. They remain on COFA Islander programs until the eligibility determination is complete. Now we will move on to Apple Health Medicaid, and I will pass this on to Ariel.
Thanks, Roz. So in Washington State, Medicaid is called Apple Health. Apple Health provides medical, vision, dental benefits, and other healthcare services such as preventative care, cancer screenings, treatment for diabetes and high blood pressure, and many other healthcare services. When you see an Apple Health provider or are prescribed a medicine covered by Apple Health, there are no co-payments, deductibles, and other out-of-pocket expenses. To find out if you can have Apple Health, you must apply. Most individuals apply through Washington Health Plan Finder, and that website is wahealthplanfinder.org. To be eligible for Apple Health, COFA Islanders must meet all Apple Health eligibility criteria. So being a COFA Islander is just one criteria. Others include income limits, Social Security number requirements, and Washington residency. Sometimes income verification may be required before you can find out if you can have Apple Health. If you need to supply proof of income, you will receive a notice with this request. On this page, we are showing an example of the income limits. So the top, the most you can make to be eligible for Apple Health through Washington Health Plan Finder. There are different income limits, which we'll look at later, for classic Apple Health, which is for people that are over the age of 65 or have a blindness or disability or need long-term care services. Here, for example, Apple Health for adults, the income limit is $1,482. Again, this is the most somebody can earn. There is no income minimum. So sometimes somebody isn't working, your income is zero, or sometimes it could be even negative. The limit is $1,482. Okay, next we will talk about classic Apple Health, and Paige and Steve will review this section.
Hi, everybody again. Okay, let's talk about some classic Apple Health. Classic Apple Health refers to programs administered by the Department of Social and Health Services. Individuals who are 65 years or older, have a blindness or disability, or need long-term services and supports apply for Apple Health with DSHS. Eligibility criteria for each program is varied, and it's based on household size, income, and resources. Programs administered by the Department of Social and Health Services are referred to as non-Magi Apple Health. Individuals can apply by submitting an application online through the washingtonconnection.org or by submitting a paper application. Next slide, please. So this slide is an example of the resources that are counted when applying for Classic Medicaid. Resources range from bank accounts, retirement funds, and certain types of burial funds, just to name a few. Another type of resource is the value of automobiles. There are a lot of rules around resources, and what is counted and what can be excluded is done during your application interview. Don't be afraid to apply if you have some of the resources in this section. You might still be eligible. Next slide, please. These are some of the long-term care resource questions. We ask about property to help determine equity in your home. We also ask if you have transferred or given away any resources within the last 5 years. Again, we can talk about this more during your application interview, so don't be afraid to apply if you do have some of these things on in this part of the application. Next slide, please. So this is an income chart to look at, and it's a lot to look at, so don't get overwhelmed when you see it, but it does have some valuable information regarding income limits and resources for individuals and different household sizes. Next slide, please. So classic Apple Health programs and services. There are many classic Apple Health programs and services available to eligible individuals, including Apple Health for workers with disabilities, which allows enrollees to earn and save more money and to purchase healthcare coverage with monthly premiums based on a sliding scale. There's the Medicare Savings Program, which helps eligible individuals by paying Medicare premiums, deductibles, and other Medicare-related costs. There's also a program called Tailored Support for Older Adults. This program provides services to support unpaid caregivers and provides a small personal care benefit to people who don't have an unpaid family caregiver to help them. And then we also have the Medicaid Alternative Plan, which provides services to unpaid caregivers designed to assist them in providing quality care to family members while also improving their own well-being. This is not a full list by any means, and it's just to illustrate the broad range of programs that are available. The Healthcare for Workers with Disabilities program doesn't have an earned income limit or a resource limit. And then to know something additional is the Tailored Supports for Older Adults does not provide healthcare coverage and is targeted for people who aren't eligible for full scope Medicaid. The services authorized are for caregiver and not the care receiver. Next slide, please. Okay, we're going to talk about spin down. And spin down is a Medicaid program for individuals who are over income for other classic Apple Health programs. When an individual has a spin down, they can choose a 3 or a 6 month base period. The base period is the number of months an individual's income is counted. Individuals are responsible for the expenses used to meet their approved spin down period, and HCA will not be able to pay for those expenses. Once an individual has shown they have incurred expenses that meet the spin down liability, coverage will begin. A new application is required at the end of each 3 or 6 month base period. When your spin down base period ends, you will need to submit a new application for benefits to set up a new base period. You may get medical coverage for all or part of the base period, and unlike the categorically coverage group, which has a 12-month certification period, spin downs are in the medically needy coverage group, and they have a base period of only 3 or 6 months, so more than one spin down may be needed. Okay, let's go to the next one. So Classic Apple Health, COFA Islanders can apply for Classic Apple Health programs via online, the washingtonconnection.org. They can submit a paper application, and this is the information where you could find that and do a search for an 18-005. The application could be mailed to P.O. Box 11699, Tacoma, Washington, 98411-6699, or the fax number is 1-888-338-7410. And if you'd like to find a location in person where you could drop off the application or go into the office and apply, the website for that is dshs.wa.gov/office-locations. And then finally, the phone number for DSHS is 1-877-501-2233. And it looks like we're up to Apple Health Next Step, so take it away.
Thank you so much, Paige. So when somebody is enrolled in Apple Health, we'll discuss what happens next. Okay, so when somebody has Apple Health, they will receive a Provider One Services card. The services card is kind of a blue-green color with the state of Washington on it. Each person in your household that has Apple Health will have their own Provider One Services card. If somebody had Apple Health in the past, they would have received a Provider One card. That card is still good. It's kind of like a social security number in that way, where it turns off. Not social security numbers don't turn off and on, but this card will eligibility turns off and on. So that card is still good if you had Apple Health in the past. You will also enroll in a managed care organization, and more information can be found on our Healthcare Authority website about managed care. Managed care, there are up to 5 managed care plans depending on where you live. You will receive not only the Provider One Services card, but a managed care card. We have examples here. The plans are Molina, Amerigroup, Coordinated Care, Community Health Plan of Washington, and United Healthcare. If you need a replacement card, you would call your managed care plan to request a replacement. You should take this card with your Provider One Services card when you go to the doctor, pharmacy, or other healthcare provider. When you have Apple Health, you have to renew that coverage most of the time on every 12 months. There are some exceptions, such as Paige mentioned, this medically needy spend down. A new application is required each 3 or 6 month base period. Or if you have Apple Health through Washington Health Plan Finder, called Magi Apple Health or Apple Health for Adults, when you turn 65, in that next 12 months, you'll have to renew your coverage then. A renewal notice will be sent to you when a renewal is due, and that notice will have your next steps in it. Renewal timeframe. So you can renew your coverage 60 days before your coverage is supposed to end and up to 90 days after your coverage has ended. So if you miss that deadline, you have up to 90 days after that deadline to renew your coverage. You will receive a termination notice, and that is sent 20 days before the end of your certification period if a renewal is not completed. But then during that 90-day time frame, if you renew your coverage and you are eligible, your Apple Health will be restored without a gap in coverage. So we'll go back to when it was terminated. Next, we'll talk about open enrollment for COFA Islander programs.
COFA
Okay.
Islander, oh, go ahead.
Go ahead.
Ari.
No, you go
No,
for
no.
it.
Go ahead, Ari. COFA Islander programs eligibility, COFA Islander healthcare, and COFA Islander dental care is still available for COFA Islanders who are over resources for classic Apple Health, approved for a spend down but have not met their spend down amount, entering the U.S. with another status, such as permanent resident, spouse of a citizen, a U.S. citizen. Individuals must meet all eligibility criteria for COFA Islander programs, including filing taxes and meeting income limits. Individuals who do not respond to a request related to Apple Health eligibility will not be eligible for COFA Islander programs. Ari, do you want to take this slide?
Sure. So we are in open enrollment right now. It began November 1st. It goes through January 15th for 2022 plan year. So for COFA Islander Healthcare and COFA Islander Dental Care, all silver level plans, qualified health plans for COFA Islander Healthcare, and all family dental plans offered are available for these programs. There is no separate renewal process. COFA Islanders currently enrolled in the program remain enrolled as long as they meet eligibility criteria. The one caveat to that is that this year, people have to go into their application and renew their health plan for next year. So during this time frame, again, November 1st through January 15th, people that currently have COFA Islander healthcare or COFA Islander dental care will have to go into their application. They can do this online, in person, on the mobile app, over the phone, to renew their qualified health plan and qualified dental plans for next year. So we recently sent a letter to everybody that still has COFA Islander programs, letting them know that they do have to go into their application. We provided the options and update their information. This letter also provides information on how to apply through DSHS for Classic Apple Health. Now, we're going to take what we learned in these last few slides here and apply them to some scenarios to see what we learned here. Roz?
Yes, thank you, Ari. Scenario 1, and this is to apply for Apple Health anytime. Marie, age 30, is new to Washington State and needs health insurance. Her auntie told her about COFA Islander healthcare, but that she cannot apply until November 1st. Does Marie need to wait for open enrollment to apply? No, Marie does not need to wait. Apple Health does not have an open enrollment period. Individuals can apply all year round. Marie applies through Washington Health Plan Finder because she is under the age of 65 and is approved for Apple Health for adults. Scenario 2. I was denied COFA. Can I get Apple Health? Jack, who is age 23, applied for COFA Islander healthcare in November 2020, but was denied because he was over income. Since COFA Islanders are now eligible for Apple Health, Jack is wondering if he can reapply for coverage. Can Jack reapply for coverage? Yes. COFA Islanders who were previously denied or terminated are encouraged to update their Washington Health Plan Finder applications. COFA Islanders must meet all eligibility requirements to qualify for Apple Health programs. Jack updates his application, and he is now approved for Apple Health for adults since his income has changed. Managed care organization change. Scenario 3. Lisa is enrolled in Apple Health for adults, and her 2 children are enrolled in Apple Health for kids. Lisa is looking for a different provider and finds out there are other managed care plans in her county. Lisa would like to change her managed care plan for her family. Can Lisa change her managed care plan? Yes. Lisa can switch to a different plan available in her area. She can change it online through Washington Health Plan Finder, by visiting her Provider One portal, or by calling the Healthcare Authority Medical Assistance Customer Service Center at 1-800-562-3022. And I'm going to turn it over to Paige to help me with scenario 4.
Thanks, Roz. Okay, so scenario 4 is regarding an application for Classic Apple Health. Joe is over the age of 65 and needs to see a doctor. His pension income is $1,200 a month. He does not have health insurance and he is not eligible for Medicare. How does he get coverage? Well, since Joe is over the age of 65, he will need to apply with the Department of Social and Health Services, also known as DSHS. His income is over the limit of $841, but he is under resources. He will be put on a spin down and he chooses a 3-month base period. This is how we determine how much someone's spin down amount is. We take their income. With Joe's income is $1,200. There's a standard disregard of $20 that everybody gets. That puts his income at $1,180. We take that amount, subtract $841, which is what the actual limit is, and that leaves Joe with $339 of countable income. We take the $339 and we multiply it by 3, and that gives a 3-month base period, and it also would make Joe's spin down amount $1,017. Once Joe can show us that he's incurred that amount of money in medical expenses, then he would have met his spin down. Next slide, please. Scenario 5 is regarding long-term services and supports. Leon's dad, Rich, is over the age of 65, and he needs home and community-based services that will allow him to stay at home rather than in a nursing facility. He applies at DSHS and completes what's called a care assessment with an home and community services social worker. He is found to be under the income limit, which is $2,523, and he's also under the $2,000 resource limit. Rich is approved for long-term services and supports and may have to participate in the cost of his care. Typically, he gets to keep 100% of the federal poverty level, which is currently $1,074, but other circumstances may allow him to keep more. Next slide. Okay, take it away.
Thanks, Paige. The next scenario is regarding medication. I need to refill my meds. So Esther has monthly prescriptions and she knew how to take care of them when she had COFA Islander healthcare. Now that she has Apple Health for adults, she's not quite sure where to get her prescriptions or how to pay for them. Who can help Esther with her questions? Well, her managed care plan can help. She calls her plan and they give her information on which pharmacies she can go to. Also, most health plans have an online tool to help a provider to help find a provider who accepts Apple Health clients. Apple Health clients do not have to pay for covered drugs prescribed by their provider. When they go to the pharmacy, they're going to take their 2 cards, Provider One Services card and their managed care card. Scenario 7 is regarding Apple Health benefits. Smith has Apple Health and a doctor's appointment in a couple of days. They do not have a way to get to their appointment and we're wondering if Apple Health can help. They call Apple Health customer service for information on transportation services. We have 2 questions here. Is transportation an Apple Health benefit? And can Smith get this benefit? Yes, transportation services for non-emergency appointments are an Apple Health benefit. Transportation may be provided for individuals that do not have transportation for healthcare appointments. Smith contacts the transportation broker in their county for help with this service. We do have more information on this benefit on HCA's website for more information and brokers in your county. Outreach efforts.
And now we move on to our outreach efforts. Throughout the transition of from the COFA Islander programs to the Apple Health Medicaid restoration, we wanted to share some of the outreach efforts that the Healthcare Authority has done to reach out to the community. We've done Gov Delivery for intentional and consistent messaging. This is a form of a newsletter that is sent out to external stakeholders. We have social media campaigns. One is this Facebook Live. We've done a couple of Facebook Live events to update the community on the transition. We've done webinars. We also have several social media Facebook posts. And now you can follow us on Instagram. We've developed and translated informational materials in the 6 main COFA languages. We've done intentional outreach to COFA Islanders, informing them of the transition and how to prepare for Apple Health and managed care enrollment. We've done these through phone calls and letters through Washington Health Plan Finder. Ari, do you want to take this?
Yeah. So part of our outreach strategy is actually to contract with a community-based organization. We've contracted with the Pacific Islander Health Board of Washington, PIB, to conduct Apple Health outreach, education, and enrollment. Some of their responsibilities will include educational events, development of outreach materials, and hosting quarterly workshops. They have interpreters available at their 800 phone number, which is 888-308-7113. You can also visit their website to schedule time, one-on-one time with a COFA navigator, and their website is pihealthboard.org, pihealthboard.org.
Thank you, Ari. On this slide, it displays examples of our social media posts on Facebook. These posts are in the 6 main COFA languages, as well as translated. It's in English translated in the 6 main COFA languages. And to stay connected with our efforts, please follow us on social media. We are now on Instagram. And we are now on Instagram, and you could find some of our videos posted on YouTube, as well as you can follow us on Twitter, Facebook, and to get the updates on the transition, the COFA Islander programs, and the Apple Health transition. On this slide, this is how you can subscribe and stay connected through our Gov delivery. You can visit the public.govdelivery.com. The link is on our dedicated webpage. That is hca.wa.gov/COFA. You can subscribe to our Gov delivery to get the updates on the COFA Islander programs and Apple Health. We move on to our resources. Like I shared, we have a dedicated page for, I apologize. There we go. We have a dedicated page for COFA Islander programs. You will find information on the transition. On this snip, you will see that we have information. We have our contact information, which is our website that I've shared, hca.wa.gov/COFA. We have our email, COFAQUESTIONS@hca.wa.gov. And we have our phone line, 1-800-547-3109. Please visit our webpage for more information. Also, as resources, we have information. We have information on free or low cost health coverage brochure, a welcome to the Washington Apple Health Client Benefits booklet, and the COFA Islander programs. We have additional information on Apple Health and COFA resources. On this slide, we have a snip of our cross-agency desk aid. This is a list, and you can find this on the hca.wa.gov webpage. And to getting and keeping Washington healthy, the pandemic is still present, and Pacific Islanders have one of the highest rates and impacted largely with COVID-19. HCA has a dedicated webpage on COVID-19 resources. And we move on to our question and answer, and I will pass this on to Ari.
Thanks, Roz. Again, please post your questions in the Facebook chat. We are here to answer questions about Apple Health, Classic Apple Health, how to apply, things like that. But first, what we wanted to do is take a little bit of time with Renza and Carlinda. Again, we're so appreciative that you're here with us today, and talk a little bit about the outreach that you are doing. And I guess my first question is, if you want to say the area you're located, and then are you outreaching in person? Is it virtual? What are you doing to outreach these days? Carlinda?
Sorry, I'm on mute. So for us in Spokane, well, I'm located in Spokane, and I'm working with the community as well. So maybe I will speak my mother tongue first, so people that are listening now can understand, and also pass it on to someone, anybody. Anyway, and then matan menako kajit kamaningan kamana utara jaga cuane ome kajangar kamane yung enang nolebien ngajit kamana utara jilo even ngame ngewar bajaban ngan mancongok rajara balteo yung ela beotar kijen cara balik loran ngajit jep call I wajit jadien jit loron jit jibangron. For our outreach effort, we usually do outreaches when there is an events, like on the Labor Day. We were able to work with a lot of marshalies. I didn't know that there were a lot of marshalies here in Spokane until I find out on the Labor Day, as well as some other events that we involve or I involved in. And we were doing in person I would say 2 or 3 months ago, but after the pandemic, again, we are now only contacting others through phone. So this is how we do it. But actually, even if I would say that it's an outreach is when I go out on events like birthday or some other events, because people always ask me questions in regards to the insurance. So I cannot tell them to wait until I'm working or on duty. I have to answer their questions. So yeah, we do community outreach sometime virtually, not virtually because some people they don't know how to use the electronic. So only if we see people in person during those kind of events that I mentioned before. Yeah. Did I answer the question?
Yes, thank you, Carlinda.
Yeah. And I would also like to share that I used to post my information on social media so people would know my contact and call me, even though I'm sorry.
We know that sound, don't we? Yeah. Renzo, why don't you introduce yourself and talk about where you're located and what you're doing?
Okay. My name is Renza Milo. I'm located in King County, but I'm also helping with Pierce County and Snoqualmie County. Even the people down in Vancouver, I got help some down there. With my role as a navigator, I'm also helping with translating and navigate people how to apply for insurance and finding resources when they need it. So with me working with the BI Health Board, I'm so grateful, and with you guys, the healthcare that are reaching out to me, joining today, and just to let people know that I'm here. My phone number is 206-602-0932. My email address, you can reach me through my email or phone or Facebook. My email address is bihealthboard.org or milorenza05@gmail.com. And that's all me as navigator and also translating with my language. I'm also happy to help with the other counties that are needing help with this. Thank you.
Thank you, Renza. Carlinda, do you want to add anything?
Yeah, I was gonna say, I was gonna tell the public, I mean, those that are listening right now, in regards to my phone number that can reach me. It's my working number is 509-381-5562. And the email address is CARLINTERHEALTHTOGETHER.org. Thank you.
Thank you so much, Carlinda and Renza. We really appreciate that information. And again, you being here today.
I'm sorry, can I just add something? We have a coming up event in Federal Way on November 20th. So if you need help with the insurance and to enroll, please come out at Federal Way in King County. Thank you.
Great. Yeah, Renza, thank you so much for that information. And for us, the Healthcare Authority, what we do every year is we post outreach events on our dedicated COFA webpage. So if you go to hca.wa.gov/COFA, you will find enrollment events to attend. It will list the county, the address, and the time that it is going on. And so check in there daily to see about new events. And again, if you have an event that you're thinking might fit for COFA Islander programs and Apple Health, you can send it to COFA questions@hca.wa.gov, and we can look at adding that to our calendar of events.
Thank you.
Yeah, thank you, Renza. Carlinda, are there any events that you would like to mention?
Yeah, I forgot to mention that there will be a health fair going on the 13th of this month, and it's going to start with the health fair from 12 to 3 p.m. and then follow on by the cultural night. I'm so sorry. Yeah, so anybody that need help with in regards to the insurance, fill out the insurance or anything like that, or any questions, then I will be available at that time. And I'm also help out with fill out the rental assistance for someone that in needs of it as well.
That's great to know that there are more services available that you can help people with, Carlinda, than just insurance applications. I'm taking a look here. I'm not seeing any questions. So I have some questions for the group here. The first one, I wanted to go back to resources for Classic Apple Health, just to kind of go over that again. So that people know. I think, Paige, you said it very succinctly and greatly that, even if you have one of these things, go apply. There's people to help you answer these questions. But I'm hoping that Steve and Paige, you can talk a little bit more about if people are paying into burial plots, is that an accountable resource? And other, I'm thinking of other kind of resources that people might have that might be land that they own back home, or pensions or Social Security from back on the islands.
This is Steve. On the resources and burial plot. Yes, that would be excluded, as in not counted. Let me just speak, please, to more of a burial fund, for all expenses related to a burial. We have a couple of terms that we use. One is revocable, or some people say revocable. It means that both parties understand that, yes, it can be purchased and you can be paying on it or paid, for it all up front, but that it can be undone. You can revoke it. For that kind of burial fund, we can exclude up to $1,500. It does need to be kept in its own separate account. It can be distinguished, from what you might have in savings or a checking account. The other term is irrevocable, or some people say irrevocable. It means it essentially cannot be undone. It's an agreement signed, and it can't be like just sold or whatever. It's, you set it up maybe with a funeral home or that type of company. That allows any reasonable amount. So if you wanted to put, say, $5,000 to $10,000 in a burial fund, we know they're very expensive these days. So if you wanted to put more in it, if it's not revocable, then we would also exclude that amount. But in the other type that I spoke to, the limit is $1,500. Hopefully that answers your question on that. And if you would you repeat the questions that came out there, please?
Yeah, so in addition to burial funds and burial plots, I was also wondering about either resources or income from back home on the island. So either land that people own, or pensions, or Social Security type benefits that people might be getting from back home on the islands.
Sure. On land that a person is not living on, so they're living here, the land rather is back on one of the islands, we would have to look at the value of that land and count it. We can not count it, though, if the person is willing to put it on the market and show a reasonable effort that it's, that they're trying to sell it. And if they will do that, then we don't have to count the value. Otherwise, a person's home and the land the home is on, as long as it's just one piece of land, it can be even larger, but just one piece of land, then we do not count that when we're looking at resources. As far as pension they might be receiving from back home, we would just see that as income as we would any income they're getting, receiving here in the States.
Thank you, Steve.
Sure.
Looking here.
We
I know-
certainly welcome questions from the audience if
Yes.
I'd like to put them forward.
Yeah, most certainly. I'm wondering if, I know we had talked a little bit beforehand, Renza and Carlinda, if you had any questions. Oh, there's one here. How do you know which qualified health plan to choose? Really, it comes down to personal choice and provider network. So who your doctors are, which medications you're taking. There are brokers that can help you make that decision. You can, in Health Plan Finder, it's pretty great because you can compare plans. You can even look up providers and medications to see if that plan covers what you need it to.
I got one question about if a person has an expired passport, how can they enroll for Apple Health?
So you, again, if you are under the age of 65 and without Medicare, apply through Washington Health Plan Finder. You want to enter the immigration information that you have. So that could be your expired passport. We might need additional information when you enter that. It could also be your I-94. I know most I-94s these days are digital, but if you know your number or can print it out, you want to enter that information there. Same thing with for classic Apple Health through DSHS. You're going to enter the information that you have, and if more information is needed, they'll ask you for it.
Thank you.
So I have a question here in regards to the TSOA, the service that provide to support those that are unpaid. So under the classic Apple Health, can those unpaid caregiver get paid, or can you be more specific on that?
Steve, you're on mute.
Sorry. Caught it the first time, but only once, right? For the unpaid caregiver, typically that might be a spouse or a family member. There are exceptions when, say, a spouse can be paid, but typically they're not. But they can receive some supports like some respite care, where someone could come in and, provide service for a while so that person could, take a break or, have any respite, what it's called. But yeah, if that resources, a couple of slides we provided here, there would be information about how, to obtain a paid care provider, one that, has gone through training and been approved by either the AAA, the Area on Aging in the Community, or DSHS. Yeah, there's programs available for that, but also for those that aren't paid, some supports to help that person, do the job that they do. Does that help answer the question?
Yeah.
Okay.
What about those that are under 65 years old? And there's a client where she's carrying her oxygen around. When she needs to go shopping, she'll need to take it with her. And her husband is the one that looking after her. So is unable to go to work because his wife is she cannot be by herself. So is there any way that they can also get any service like those resources or get paid?
Well, she could, try to get go for a provider other than her husband, who through the register, through DSHS, and they would be paid. But typically, that's the way it works. But again, though, one should always go ahead and call that number, talk to the local, like home and community services office. Like I said, there are some exceptions when a spouse can be paid, but I don't want to say that happens often, because I don't want to, give someone an expectation. But I would just encourage them to call and get, the people at those offices. They'll help in any way they can and provide as much information to try to meet that person's individual need.
Thank you, Steve.
Sure.
We have another question from the chat, looking for a little bit more guidance on what the difference is between classic Medicaid and Medicare.
Well, Medicare, it provides its own set of services, but a lot of them have limits to maybe the length of time. Say in a nursing facility, it will pay, like the first 20 days, I believe. But after that, one would need Medicaid to, stay there long term if they don't have, other coverage or couldn't pay for it out of pocket. Medicaid, though, provides a lot of services like mental health benefit is much better under Medicaid. There's very little mental health benefit under Medicare. In general, there's not a Medicare dental or vision plan. For people who would need that, Medicaid could help them. And then Medicaid can also help pay for their out-of-pocket Medicare expenses, like their Part B premium, or Part B also has a deductible each year.
Thank you so much, Steve. We're almost at time here. I want to again say thank you so much for joining us today on our Facebook Live regarding COFA Islander programs and Apple Health. Thank you to Paige and Steve, Carlinda and Rensa. Thank you, Stephanie and Roz. Have a great day, everybody.
Yeah, thank you. Appreciate being here.
Thank you.
Yes.
Thank you so much.